Hi, my name's Andrew Sherman, and I'm Chief of Cardiothoracic Surgery at St. Joseph's Hospital in Tampa, Florida, within the BayCare Health System. The hybrid operating suite at St. Joseph's Hospital is essential for these procedures to be performed. It is a fully functional catheterization laboratory, and it is a fully functional operating room. So the personnel that are in the hybrid suite during the procedure are two of the structural cardiologists at our institution, two of the cardiac surgeons that are at our institution, and two of our cardiac anesthesiologists. One who mainly takes care of the patient and the patient's vital signs, and the second who is almost solely responsible for a very specialized echo or ultrasound of the heart that we do during the procedure. So before we ever make it to an operating room, we have very specialized valve clinic meetings where each patient is discussed. Each patient will review multiple studies that have been performed, CAT scans, cardiac catheterizations, multiple different forms of echoes or ultrasounds of the heart, frailty assessments of the patients, all the patient's history. We all go over all of that information, and as a team, we try to come up with what the best approach is. So when you're a patient, you see all of our individual physicians as part of the workup process, but the added benefit to the whole process is that when you see us once, we're actually behind the scenes talking about your particular case on multiple different occasions until we are sure we have just about every step of the process planned out as best as we can predict. Our new Heart Institute at St. Joseph's Hospital that the hybrid operating room is a part of was set up with the idea that we would have what we call a team approach. So whether if it's bypass grafting or the TAVR procedure that we've talked about, or an electrophysiology procedure, a minimally invasive procedure for atrial fibrillation, everything is done with a team of physicians talking together, discussing a patient's condition, and coming up with game plans together. That is not only the future of medicine, but that's the present of medicine. And this Heart Institute has really allowed for collaboration of physicians because we are all in one spot, we share the same conference rooms. If we tried not to talk to each other, it wouldn't be possible to get through a day. We have many patient success stories that we're proud of. And I think that's the most benefit. When people ask me as a physician, what's your favorite part of the day? And I think when I see a patient in clinic who I knew from before an operation was struggling to get their own mail, was struggling to cook a dinner for their family that they were able to do, was struggling to walk around a golf course, was struggling to walk out of the house. When I hear that that patient is now showing up in my office after a procedure and is able to do any of those things, but do them better than they've done them for the last 20, 30 years, that's the only gratitude I need in this profession, is to see patients without restrictions enjoying the things they want to do in life.